Hi everyone, this is Farah and I'm here at Health 2.0 Conference Dubai and I have here with me Dr. Sarfraz. Welcome. Can you please introduce yourself and your organization?
Yeah. So thanks for having me here. Uh, my name is Dr. Sarfraz, as you mentioned. I'm working as the Associate Vice President for Abeer Medical Group. Abeer Medical Group is an organization which operates hospitals and clinics across the Middle East. And I say Middle East because we cover all the countries except Bahrain. So it's very easy to say that rather than telling all the countries we do operate in. Predominantly headquartered in Saudi Arabia. We are operating, multi-specialty hospitals, primary, secondary, tertiary, specialties across the hospitals. And for example, we operate beyond Saudi, where we operate 21 units plus. We do operate in Oman with a hospital, Abu Dhabi with the Rayk Surgical Center, Qatar, Kuwait, and so on. So we are into the business of healthcare.
Thank you for this introduction. First of all, I'd like to start by saying congratulations for the award. How did it feel to receive this kind of recognition for your work?
I think it really feels good, and thank you so much for that. And recognition is always a motivator. It's always a motivator for you to go ahead and do more. I think that's what I would put it as.
Now, can you give me a piece of advice that you would give to someone based on your years of experience in this industry? Someone who would like to get into the healthcare industry as well. What would you tell them?
Well, I think the most important thing for anyone who wants to be in healthcare or any industry for that matter, specifically healthcare, is you should have situational awareness and self-awareness. So I think that's paramount. You should know what's happening around you, and you should know what's happening within you. Beyond that, I think if you are genuinely interested in people, when I say people, it could be your colleagues, it could be your juniors, it could be your patients. So I think be genuinely interested, because when you're genuinely interested, the people feel it. They feel that yes, this person or this organization actually cares. So I think those are three things: self-awareness, situational awareness, as well as genuine interest for the people.
I love how you worded it, be aware of what's happening around you and within you. I think that's very important. So I completely love that. I'm definitely taking that away with me.
So I guess when you look at it in a bigger, with a bigger view, business is all about making sure that you're relevant. Okay, you make your relevance based on the way you conduct your business, based on the way you grow your business, and based on the way you treat your business. So I think if you're not aware of what is the external environment, if you don't know what's happening around you, the market is very dynamic. Okay, the customers are very dynamic, and I'm just saying customers. I'm not saying patients, because for multiple reasons. So you should know what's happening around you. When I say what's happening within you, as a business or as as a person, there are requirements which the market expects. There are requirements which your customers expect, and there are requirements which your staff expects. So I think a very important parameter is to understand what is going on inside, and if you can balance these two, I think that's what it is all about.
Definitely. Thank you for that wonderful advice. I'd like to ask you some questions about AI. So, as you know for sure, AI is such a hot topic right now and it's basically being involved everywhere. So, how do you think AI or digital transformation in general could have an impact on the healthcare industry?
Well, I think if you look, okay, I'm going to divide healthcare into two phases. There might be agreements, there might be disagreements, but I'm just basing this on what I've seen operationally. So there was a part of healthcare which was pre-COVID, and this part of healthcare which is post-COVID. I think a lot of movement, translation of healthcare has happened online. A lot of it has happened on the digital front. When you say AI, I think not just AI. If you have to club AI and machine learning, because you are looking at predictive diagnostic modalities. I mean, you're looking at, even from a business standpoint, AI is very important to understand what are the needs, or what is the history, or what is the trend. Okay, you use AI to predict the diagnosis of the disease pattern. You use AI to predict the kind of, for example, you want to open a medical facility. What specialties do you want to put in? What do you think is the need of the hour? So I think AI is pretty important in predictive analytics, if I can say that. And digitalization of healthcare is something, I believe, if you're not digitalizing your own, in your own businesses, you're actually losing out, because that's the way it is. That's the way it's going to be.
So, do you think it'll bring more benefits or drawbacks to the industry?
I think it will. I think it will, because just if you look at Health 2.0 conference today, we have had people who are clinicians, we have people who are entrepreneurs, and you've got techies with finance guys. I can't think of a scenario wherein you would actually have techies in a health conference. And you look at India, for example. Just for the heck of it, I'm not being very specific on that. The number of startups which have come in the health ecosystem are many, and from I think post COVID, this is gaining a lot of traction. So I think yes, tech and healthcare and the delivery of healthcare. These are going to be three components which are going to work together.
Well,
Patients, right, of course.
yeah, hopefully. I hope so. Can you tell me about your experience at the conference so far? I mean, you've given us an idea now, talking about how it's so many people from different industries, but how did you personally find that? Were you able to network with a lot of people here?
I will say I was pleasantly surprised. Okay, because generally when you have the word health, you think of doctors and you think of medical stuff and patient experience and you talk about regulators and so on and so forth. But it was very refreshing to have a lot of entrepreneurs. It was very refreshing to meet people from across the globe. I was just having a very good discussion with someone who's from US, working in the mental health space, with an app-based startup. So, I mean, this was amazing, and I think this is where things are going to head to. So I would like to congratulate Health 2.0 for having for gauging the situation, gauging the scenario, and then coming up with this particular conference. It's been amazing so far.
We're so happy to know that you're having a good time here, and hopefully you'll have a good second and third day as well.
Yeah, looking ahead to that.
Thank you so much for being here, and congratulations again.
Thank you so much. Thank you for having me.